Hi everyone. Ganito lang kaliit yung class nyo. How many are you in the class?
4.
Okay. I'm Dr. Angeli Espiritu Kabangkalan. I'm a pediatric pulmonologist. Tapos kayo ay in third year, no? Sorry. This is just, I'm relatively new in the teaching pediatrics, usually sa pharmacology. So, nag-lecture ako sa inyo last year, no? Sa second year, okay. So, sorry for being late. Never na ako nasanay mag-drive to this far. So, the traffic. So, you've watched the video, yung based on Bates, about the pediatric physical examination. So, that will teach you the techniques, the basics of pediatric PE. But you will just be going over some features or some important points, some common missed findings in the pediatric PE. So I hope this doesn't take too long. So first of all, we must always remember that a good history will almost always yield 80 to 90% of the diagnosis. So good history taking is usually what distinguishes a good clinician from not so good clinician. So this is very important that you be thorough. And if you have questions about history that was just relayed to you, I always make it a point to do my own history. Parang di ako natatahimik until I do my own history because it will definitely give you clues to the diagnosis, especially for problematic or diagnostic dilemmas. So, Dr. William Osler, or Sir William Osler, one of the fathers of modern medicine, said that there is no more difficult art to acquire than the art of observation because it will take years and years of practice before you develop that what they call the clinical eye that will streamline your technique in doing your PE. It is important to remember also that the child is not a mini adult. So many of the parang dekahon na diagnostics and management that you usually practice in internal medicine are not usually or always applicable to pediatric patients because children are unique in that they are, of course, growing and maturing, and they differ in terms of the growth, their morphological changes which are ongoing, their immune systems are relatively immature, their organic composition are immature, sexual maturation, and of course there are certain diseases that are only particular to childhood, and there are diagnostic methods that are age-specific, and of course the therapeutics will vary usually based on the age, weight, body surface, etc. Not to mention the psychological characteristics of an ongoing developing person. So while you're doing your PE, you can continue with your history taking, and then you can verify the accuracy of the history by correlating it with the physical findings. For example, for some vague words or terms in the history taking, like in the Philippines, some parents would say pantal, which is a generic term they use for rashes. But medically, pantal would really mean a wheal. Mas accurate to say that pantal is a wheal or urticaria. But in general, sasabihin nila nagkapantal. And then, also in Pedia, yung patients, because I'm a pulmonologist, parents would usually say halak. Halak, if you're familiar with the term. But what is halak? Ano ba yung halak? So you should confirm that with the parents. And ito ba yung narinig mong halak? Because sometimes you would outrightly hear stridor from a patient, for example, from a newborn. So what is stridor? Stridor is an inspiratory sound that is high pitched that would usually indicate what? Starts with an O. Obstruction. So it's usually upper airway obstruction. So iba naman yung hala to some parents, which is usually just chest gargles or throat gargles, which is usually associated with like reflux or milk feeding, improper feeding practices like in that inadequacy of burping practices, so, and the like. So you can verify that while you're taking your physical examination, you're doing your physical examination. And just to note that parents are impressed usually by the doctor who completes the physical appraisal and are dissatisfied with those who hurriedly do their PE. So for our purposes, it's important to it's important to think always about the parts of the physical examination. So we know that it's inspection, palpation, percussion, and auscultation. So from the least invasive to the most invasive. But through years of practice, you will realize that especially in pediatrics, it's not always possible or practical to follow this sequence. So that's when you develop the art of medicine, or in this case, the art of pediatrics. Because for certain patients, especially those you already know, or you have an idea about their behavior, for example, a very unruly, hyperactive toddler, or maybe a very anxious toddler, that's more common, like at the peak of their stranger anxiety, 1 to 2 years old. So you know that if, for example, if the parent brings the child asleep, ako alam ko na that should go straight to auscultation, because once the patient wakes up, you will miss the entire the opportunity to examine or to auscultate the whole consult. So which your time cannot afford. So sometimes for patients na alam kong magigising and mag-iingay na, iiyak na. Because essentially, crying, an auscultation in a crying patient or a crying child is practically almost always useless. So you have to auscultate quietly. So yun, hindi mo na maka-follow yung sequence. And then, yun, as we mentioned, you can refer to the videos for the skills and the techniques. But let's go through the systems and look for or the parts of the physical examination or the body parts, and mention some missed findings usually. So fascies, we know that fascies are appearances that are a group of appearances that indicate a certain condition or a disease or a syndrome usually. So, for example, allergic fascies, you will see particular features in the face. In the following slides, let's look at that. We can also miss, especially for for older kids, sinusitis. You should palpate the over the face, over the sinuses, and look for tenderness. Unilateral nasal discharge, so during your rhinoscopy, can indicate, for example, foreign body or a nasal polyp, or rarely a mass. And also, although not pleasant to examine, but note of or observation of a malodorous breath na it's hard to do this since nakamask na tayo lahat. So, examples of fascies. An example of a typical fascie is the Down syndrome or trisomy 21 fascies. They have a small rounded head, a flattened nasal bridge, oblique palpebral fissures, prominent epicanthal folds, and small low-set ears. So you look at that, you check for that by drawing a line from your eyes to to the upper border of the ear. So as you can see, the ears are way below the eye line, so low set ears, which are shell-like, and a relatively large or sometimes protruding tongue, which makes them prone to snoring and sleep apnea. So these are the fact sheets of a patient with allergic rhinitis, sometimes with an open mouth because of the nasal congestion, discoloration and edema of the lower orbitopalpebral grooves, which we call allergic shiners. And they're often seen to push the nose upward and backward with a hand. This is called the allergic salute. And grimacing to wrinkle the nose and the mouth to relieve the nasal itching and obstruction. So it creates a crease over the nose. A common finding also in the examination of infants or newborn age is a seborrheic dermatitis, which we call the cradle cap. This is a yellowish, patchy, greasy, scaly skin rash that occurs over the scalp, sometimes very severe. It's usually not itchy and bothersome, and it's extremely common, and it usually disappears without treatment. So sometimes we just advise the parents to put baby oil or other emollients. And if it's seen over the other parts of the face, like on the cheeks or the eyebrow line, they're called just seborrheic dermatitis versus the term cradle cap. So some changes in the eyes, in polyarteritis nodosa, red weeping eyes, conjunctival suffusion or injection, redness is seen in Kawasaki, leptospirosis. Later we will show a slide about Kawasaki findings, P findings in Kawasaki. And reddening of the palpebral conjunctivae may indicate infectious mononucleosis or SLE, and flictennular conjunctivitis in TB. So the typical pink eyes or sore eyes is usually viral, but can also be bacterial, but usually viral. Is caused by common viruses that also cause the common cold. So, red eye. And then in the throat, before you examine the throat, you should also ask about the character of the cough, if it's productive or dry. And then you can proceed to look for the source and character of the phlegm. So in examining the throat, you might note a postnasal drip and cobblestoning. So these are shown in this next two slides. That's your postnasal drip. A very important finding, because most patients who would come to you with a viral nasopharyngitis would be coughing because of your postnasal drip, which is usually viral. And then the cobblestone throat can be also because of an infection, ongoing infection, but more often because of a chronic rhinitis causing chronic postnasal drip. So, alam niyo yung cobblestone, di ba? Yung flooring sa vegan. So, tonsillitis, inflammation of the tonsils, can present with sore throat, fever, and can also be bacterial, although usually viral. And these are the features and some pictures of your tonsillitis. On the far left, almost like a tonsillar abscess. Abscess would be a more deep-seated infection, as we know. So, this is just your normal tonsil to show a diagram. Parang nakasilip lang sila. Or not visible. And then, how about this? Some would automatically say this is tonsillitis, or the resident in the ER would say magayong tonsils, but knowing your patient or seeing for yourself would say that would tell you that this is just what we call chronic hypertrophic tonsils. So, malaki lang talaga yung tonsils niya. Hindi siya inflamed, hindi siya infected, walang exudates. But a lot of our patients, a lot of my patients, because of my subspecialty, would have this. Also associated with allergic diseases. But they just have big tonsils, which may cause snoring, and in the severe extreme case may cause obstructive sleep apnea. So in examining the ears, the best view, if you remember from the video, is how to manipulate the earlobe. Pull, naalala niyo ba? Pull upward, outward, and backward. So that's how you can view the eardrum, the cone of light, and the parts of the tympanic membrane on this slide. And the ear infection the hallmark is usually sudden pain, when lying down it's worse, and these are the other symptoms, usually upper respiratory tract infections as well, and there may be fever. In babies, it's a little bit tricky. It's not always or practical that you can do otoscopy, but some of the signs are refusing a bottle or crying because of the pressure in the middle ear during swallowing. And then these are some pictures of the middle ear infection, acute otitis media. The one on the right showing, what do you see? What do you see? You see the eardrum that is, anyone? Bulging, diba? Bulging tympanic membrane. So that's really the diagnostic criteria for saying that your patient has AOM. So on the right, a little bit milder than the one on the left. Sobrang bulging na itong left. And then, otitis media with effusion is even a different condition. It's not necessarily acutely infected, the eardrum, but it can be a complication of post AOM. So you see there fluid inside the middle ear. A ruptured eardrum, when there's too much fluid building up in the middle ear and putting pressure, can cause rupture. And it sounds frightening, but it usually heals spontaneously in a couple of weeks unless there's repeated rupture, which may affect hearing eventually. Some benign congenital malformations you may see in newborns or children are the tawag nilang kutil, di ba? Accessory tragus. It's common in the preauricular area before the tragus. But sometimes you may see it very rarely in the mandibular line or away from the ear. So they're soft, flesh-colored, pedunculated papules. And very common are preauricular pits and sinuses. So these are manifestations of a preauricular cyst. There's swellings in the preauricular regions. And if there's a sinus, usually it gets repeatedly infected, and you will see in kids that they there's always discharge coming out episodically. And then in the neck, you should be able to differentiate versus nuchal rigidity, usually with your Brzezinski sign, versus limitation of motion. And look for lymphadenopathy. it's especially in the patient, the supine patient, it's practical to also auscultate in the axilla. Look for findings like your friction rub, changes in the character of the breath sounds. Um, in your heart PE, look for murmurs, of course, and abnormal cardiac rhythms, but we should always remember about the normal sinus dysrhythmia or arrhythmia, which is, anyone? Do you remember from the video? Changes in the heart rate. During inspiration, heart rate increases or decreases? Increases and then decreases during expiration. So look for the PMI, the point of maximal impulse, which is usually the same place of the apex speed when in normal individuals. Don't forget to palpate for organomegaly and masses. The kidneys aren't usually palpable in children, so that should alarm you if it's palpable. Changes in the intensity of the bowel sounds, and look for muscle guarding. In the anus and the rectum, although this is immediately examined after birth when the nurse or the doctor catches the baby in the nursery, it's one of the routines that a thermometer is inserted into the anus to check for patency. Pararectal tenderness can indicate in older children, can indicate a ruptured appendicitis, and look for anorectal an anorectal abscess in the examination of the anus and rectum, which is actually not part of the routine physical examination unless there's a complaint about the abdomen or the anus. So this is just a slide about imperforate anus or anal atresia. Aside from the imperforate anus, it may be associated with other anomalies like spinal defects, heart defects, TEF or tracheoesophageal fistula, esophageal atresia, so TEF with esophageal atresia, renal and limb anomalies. These are possibilities, but imperforate anus can also be isolated. In the perineum, you should look for you can assess the size of the clitoris, absence of the vagina, a perforated hymen like in examining for child abuse, and look for vaginal discharge. In males, some findings are phimosis, which is your inability to retract the prepuce or the foreskin over the glans or the head of the penis, and look for scrotal asymmetry or enlargement. So this is your normal-looking female genitalia. And about this slide, do you think it is normal or abnormal? Normal, yeah. So this baby is probably African American, kaya ganun yung pigmentation, but it's normal. And then this one. Normal. What do you think that is yung lumalabas sa anal opening? Ano yan? In a newborn. Meconium. And then, that one, yung sa vagina, that white cheesy material is called vernix caseosa. So I always advise newborn parents of newborns to not force to clean it. So minsan lalo na to trauma. So it will shed off eventually with daily bathing. So this is a picture of a hymenal tag. it can be a normal variant in some newborns due to excess maternal hormones, estrogen, and it will resolve spontaneously. Pictures of cysts, like, which are rare actually, but this is a paraurethral cyst and a vaginal cyst. And then, how about this one? Normal or abnormal? Sorry? Abnormal. What do you think this is? Ano to? Sorry? Bingi ako. Pakilakas. Ano to? Anong comment nyo about the genitalia? It is ambiguous. So, yung ambiguous genitalia, this is the usual presentation, male appearing external genitalia in female newborns. So, pag in-ultrasound sila eventually, you'll see ovaries and a uterus. And this condition is commonly caused by what? What condition that we test for in newborn screening? May mga ganun na ba kayo? Pathology. Congenital adrenal hyperplasia. Diba? So, usually, at birth, alam mo na that they are CAH because of the ambiguous genitalia. So, parang virilized yung kanilang genitalia. So, on the left, there's a male appearing genitalia but no palpable testis in the presumed scrotal sac. So, akala parang cryptorchidism lang or undescended testis. And it also can present like the one on the right. There's just a clitoromegaly appearing like a penis. So, detected agad yung CH. Whereas in males, they usually present at around a couple of weeks of life with adrenal crisis. So vomiting, so on failure to thrive, poor feeding, and then when they are tested, hyponatremia and hyperkalemia. You can recall the pathophysiology of CAH. So the urethral opening can be anywhere along or above or below the surface of the clit. We already discussed this, phimosis. So this is just a diagram showing the unretractable foreskin in phimosis. And hernia, a common pathology you may find in the examination of genitalia is when you say hernia, you have a protrusion of an organ or a fascia of an organ through the wall of the cavity that normally contains it. So something that's going out of where it's supposed to be. So most common is the inguinal hernia, and it's divided into the indirect and direct inguinal hernia. So most of them are indirect inguinal hernias where the inguinal canal is entered via congenital weakness at its entrance, which is called the internal inguinal ring. And uncommonly, the hernia is direct, and the contents are pushed through a weak spot in the back of the inguinal wall. So you should inspect and palpate the inguinal and femoral areas for bulges. In females, it's more common to have femoral hernias. So in the extremities, look for tenderness, rashes, desquamation, vasculitic changes. In the skin, we have some different typical rashes in the following slides. What do you think is this in the rash of an infant or a newborn? Sorry? Acne, atopic dermatitis. It's actually more of consistent with acne, like acne, papules, pustules, seen in infants, the cheeks and the forehead, and the cause is usually unknown. they may be inflammatory or due to Pityrosporum species rather than true acne. And it's also, you also must be able to practice differentiating it from erythema toxicum. Sounds very scary, but actually this is a benign self-limited eruption in newborn. So it appears after a few days of life or after a few weeks, and it's very, very common, especially in Asian newborns. So they're just also like pimples, but they usually resolve spontaneously. It can be mild, like in the right picture, but it can be like severe, almost appearing like an infection on the left. How about this one? Atopic dermatitis. So it's itchy, it bothers the baby, they're usually fussy because of this rash. And in babies, it's most common in the cheeks. It can be very weepy if it's severe and dry and scaly. And sometimes you will also see it in the elbows, chest, the trunk. How about this? This is what we call milia. They are white bumps or papules. They usually appear in the nose and the face. They are caused by skin flakes blocking oil glands, and they also will. They're also benign rashes that will disappear on their own. Look for birthmarks. Very common. Hyperpigmented nevi. And then, how about this one? Impetigo. So the typical description is they have a yellow-brown crust that develops after after an initial red sore or blister, and then when they break, they can ooze serous fluid, and then they develop into this crust appearance. They can appear anywhere in the body, and especially around the mouth. So this is very infectious, and sometimes siblings are all affected over the course of weeks, and common in ages 2 to 6. This is the typical rash of chickenpox, usually described as a vesicle or a blister over an erythematous space. So it can go through stages as the disease progresses. So blistering, and then the blisters burst, and then they dry up and crust. So when they're all crusted, the patient is usually rendered non-infectious. How about this one? What do you think is this rash? Urticaria. So urticaria, also commonly known as hives, are rashes or welts that are itchy. They may burn or sting when they're severe, and can appear anywhere on the body, and they may last minutes or days. So very typical for urticaria is your clue is that they are like they appear and disappear over the course of days. Sabihin ng mother na lubog litaw sila. How about this rash? How would you describe this rash? Maculopapular, di ba? Ito yung typical na maculopapular rash. So, this is the typical rash of rubella or German measles. Not measles, because we know that measles is a more serious viral exanthem. But measles is fever and then rash, high fever and then rash becomes progressive and severe, and it's more severe with in terms of complications like pneumonia. But for rubella, this is just low fever, and then the rash is mild and spreads from the face to the rest of the body like measles. It's just serious for pregnant women who become infected because of the risk of congenital rubella syndrome. Heat rash, bungang araw, very common. So it's a result of blocked sweat ducts. And they are pink or small red papules over creases of the skin or skin folds that are usually sweaty. Jaundice is a very common finding, happens almost in all newborns. It occurs 2 or 3 days after birth, which is normal. It's abnormal if it happens within the first 24 hours, you know that. And it progresses from the face, so from the eyes downwards, and then when it resolves, usually after 2 weeks of life, it also disappears from the feet, and then the last to disappear is the ictericia. So, especially in preterms or exclusively breastfed babies, the physiologic jaundice is usually exaggerated and extended. So, sometimes during their binyag, parang icteric pa konti yung eyes nila. As long as the baby is feeding well, pooping well with normal charactered or colored stools, it's okay. Herpes simplex virus. So, in this lecture, it was labeled as such. By the way, this lecture was also adapted from the lecture of Dr. Arsena, but I've added some slides over the past year. And just to say that in kids, especially those under 7, this kind of rash can also be seen in what we call herpangina, which is also a viral enanthem, usually caused by common viruses, enteroviruses like Coxsackie. So ganito din yung itsura and it's viral. And in Kawasaki disease, also called mucocutaneous lymph node syndrome, this is an autoimmune disease that is a systemic, medium-sized vessel vasculitis. So it's common in the less than 5, that's a typical age. And it may affect organ systems like anywhere where there are blood vessels. So skin, mucous membranes, lymph nodes, and the most dreaded complication are coronary and artery aneurysms. So the bulbar conjunctival injection or conjunctivitis in Kawasaki is unique because it's non-exudative. There is limbic sparing, and it's usually, of course, bilateral. And the slide on the left shows us the polymorphous rash in the face, also in Kawasaki, and the cracked lips. These are the findings. The conjunctivitis, as we've said, and then the strawberry tongue, and then the rash involving the perineum, usually palmar erythema, often with brawny edema of the dorsum or dorsa of the hands, erythema of the soles, swelling of the dorsum of the feet, desquamation of the fingers, and then if the patient has a BCG, it may also present with erythema and induration of previous BCG, and perianal erythematous desquamation. So just some of the findings in Kawasaki. And of course, fever. So important yung fever of at least 5 days. HSP or Hinoch-Schönlein purpura presents with a triad of palpable purpura, arthritis. So there should be, pag sinabi mo arthritis, there should be inflammation, redness, swelling, and abdominal pain. So with kidney involvement, there also may be a loss of small amounts of blood and protein in their urine that may be unnoticed, and in some cases, the kidney involvement may proceed to CKD. So HSP is often preceded by an infection like pharyngitis. So this is your HSP rash, usually in the dependent areas like the buttocks, the back of the legs. Yung mga clues nyo. And I think this is the last slide, hand, foot, and mouth disease, which is really quite related to the one I mentioned previously, herpangina, because hand, foot, and mouth disease is also caused by an enterovirus, Coxsackie virus. So it's just like your herpangina vesicular rash, but there's a typical distribution, as the name connotes, around the mouth, inside the mouth, and in the palms and the soles. And they are usually painful, especially at the height of fever, when the rashes become more severe. So if you have any questions, now would be the time to ask. Or gusto niyo na umuwi lahat? Okay. Okay. There are no questions. Thank you for your attention.